What if your body was already showing signs of prediabetes without you even realizing it? This silent condition could be setting in right now, raising blood glucose levels and creating insulin resistance. The problem: most people only find out when it has already progressed to type 2 diabetes. Symptoms like fatigue, dry mouth, dizziness, and even unexplained weight loss could be signs that something is wrong. Ignoring these warnings can come at a high cost. Complications like diabetic neuropathy and heart problems are closer than you think. But if identified in time, these signs can be a turning point. Imagine your body is sending you a red flag, but without loud sirens or flashing alarms. Prediabetes is exactly that. A silent warning that blood glucose levels are higher than normal but haven't yet reached the critical point of type 2 diabetes. It's like standing on the edge of a cliff. One misstep could lead to a fall, but there's still time to step back and change course. The problem: many people ignore these signs and continue with habits that accelerate this progression. Insulin resistance is one of the main culprits behind this condition. When the body starts losing sensitivity to the hormone that regulates blood glucose, sugar builds up in the bloodstream instead of being used properly. It's as if the body has a lock that no longer responds to the key. And the worst part? This process often doesn't show obvious symptoms, allowing prediabetes to go unnoticed for years. The good news is that this trend can be reversed before it turns into a definitive diagnosis of type 2 diabetes. The key to changing this trajectory lies in the hands of those who recognize this warning and decide to act. Small adjustments to a healthy lifestyle, such as adopting a balanced diet and regular physical activity, can make a huge difference. After all, if you knew that a small daily change could prevent serious complications in the future, wouldn't it be worth trying? And speaking of that, how exactly can these changes impact your body and reverse this condition? The truth is, there's no magic pill to reverse prediabetes, but there's something even more powerful: lifestyle transformation. A balanced diet is one of the first steps to keeping blood glucose levels under control. Cutting back on excess sugar and refined carbs doesn't mean giving up the pleasure of eating, but rather choosing options that nourish the body and avoid blood sugar spikes. Swapping white bread for whole grain, adding more protein and fiber to your plate, and reducing ultra-processed foods are simple but effective changes. Physical activity also plays a crucial role. Regular exercise helps increase insulin sensitivity, making it easier for glucose to enter cells. It doesn't have to be anything extreme. A 30-minute walk a day can make a huge difference. And if the gym isn't your thing, how about dancing, cycling, or even gardening? The important thing is to move your body in a way that's enjoyable, because that makes the routine sustainable in the long run. Additionally, getting good sleep and managing stress are factors that often go unnoticed but directly affect blood glucose levels. Poor sleep and excess cortisol increase insulin resistance, making it harder to control prediabetes. Small habits like meditation, deep breathing, and creating a relaxing nighttime routine can bring surprising benefits. But are healthy habits alone enough to prevent this condition, or does genetics also play a role? Many people think prediabetes only arises from poor diet or lack of physical activity, but the truth is that genetics also play a significant role in this equation. If someone in your family has or had type 2 diabetes, your chances of developing insulin resistance increase. It's like inheriting a ticket to a risky game. You didn't choose to be in it, but you can decide how to play to avoid the worst outcome. And that's exactly where daily habits come in, which can activate or deactivate this genetic predisposition. In addition to genetics, certain risk factors make some people more vulnerable to prediabetes. Obesity, a sedentary lifestyle, advanced age, and even hormonal disorders like polycystic ovary syndrome can increase insulin resistance. The problem is that, in the hustle and bustle of daily life, many ignore these signs and only realize something is wrong when symptoms are already advanced. But what if it were possible to act before that happens? Science has already proven that, even with a genetic predisposition, a healthy lifestyle can prevent or delay the progression of prediabetes. The secret lies in knowing your own body and paying attention to risk factors. If you have a family history of the disease or fit some of these factors, you don't need to panic, but you should use this information as motivation to take care of your health. Monitoring blood glucose, seeking medical follow-up, and adopting preventive habits make all the difference. But what really happens in the body when insulin starts to fail? Insulin is like a key that unlocks cells so glucose can enter and be used as energy. But in prediabetes, this key starts to fail. The body produces insulin, but the cells simply don't respond correctly. This phenomenon, called insulin resistance, causes sugar to build up in the blood instead of being utilized. Imagine having a full gas tank, but the fuel can't reach the engine. Over time, this excess glucose can overload the pancreas, which needs to produce more and more insulin until it can't keep up. This process can go unnoticed for years, until the symptoms of prediabetes start to appear. It's a silent game, where the body tries to compensate for insulin resistance without the person realizing it. But there are subtle signs that something might be wrong, from constant fatigue to changes in the skin. And the worst part is that, without intervention, this condition can progress to type 2 diabetes, bringing serious complications like diabetic neuropathy and cardiovascular problems. The good news is that this cycle can be interrupted before it becomes a bigger problem. The combination of a balanced diet, physical activity, and weight control helps restore insulin sensitivity and keep blood glucose levels healthy. Small changes in routine can have a huge impact on preventing type 2 diabetes. But before thinking about the solution, it's essential to recognize the signs. After all, how can you know if your body is already crying out for help? Prediabetes doesn't always give obvious signs, but the body often sends small warnings that many people ignore. These symptoms are like subliminal messages from the body, asking for attention before blood glucose spirals out of control. Some are subtle, others can easily be confused with everyday issues, but they all have one thing in common. They indicate that something isn't working as it should. Let's explore the main signs so you can identify if your body is already showing indications of insulin resistance. Nausea and vomiting. It may seem strange, but when the body can't process glucose properly, it may turn to other energy sources, like fat. This can lead to the production of ketones, substances that, in excess, can cause nausea and even vomiting. If this happens without an apparent reason, it's worth investigating. Dry mouth. Increased blood glucose can reduce saliva production, leaving the mouth constantly dry. Besides discomfort, this increases the risk of cavities and gum infections. Limb pain. Diabetic neuropathy can start silently in prediabetes. Tingling, numbness, or pain in the feet and hands are signs that nerves are being affected by excess sugar in the blood. Fruity breath. If the body is burning fat for fuel due to inefficient insulin, it may produce ketones, causing a sweet odor in the breath. This happens mainly when glucose levels are elevated for long periods. Itching and dry skin. High glucose levels affect small blood vessels and nerves, resulting in dry skin and itching, especially in the extremities. Unexplained weight loss. When insulin doesn't work well, the body may start consuming fat and muscle for energy, leading to unexplained weight loss. Irritability. Sudden mood swings may be linked to fluctuations in blood glucose levels. Irritability, anxiety, and even depression can be direct consequences of prediabetes. Sexual dysfunction. Insulin resistance affects blood circulation and nerves, directly impacting libido and sexual function in both men and women. Dizziness and dehydration. Excess glucose in the blood can lead to increased urination, causing the body to lose more fluids and essential minerals. This can result in dizziness, fatigue, and even fainting episodes. Vision changes. Fluctuations in blood sugar levels can cause swelling in the eye's lens, resulting in blurred vision or difficulty focusing. Recurrent infections. The immune system becomes more vulnerable when glucose levels are elevated. Urinary, fungal, and skin infections may become frequent. Darkened skin on the neck. Acanthosis nigricans, characterized by dark, velvety patches on the neck, armpits, or groin, is a strong indicator of insulin resistance. If your skin has started changing color without explanation, it's time to investigate. These symptoms may seem unrelated at first glance, but together, they indicate that blood glucose is out of control. If you recognize some of them in your routine, it's ideal to seek a medical diagnosis as soon as possible. But how can you know if these signs really point to prediabetes? Recognizing the signs is the first step, but that alone isn't enough. You need to confirm if blood glucose is truly above normal. The big problem with prediabetes is that it can hide for years without causing obvious symptoms. Many people only discover the condition when it has already progressed to type 2 diabetes. That's why routine exams are so important. A simple fasting glucose test or an HbA1c test can reveal if blood sugar levels are getting out of control. And don't think this is only for those who already have symptoms. If you have a family history of diabetes, are overweight, or lead a sedentary lifestyle, you should be even more vigilant. Insulin resistance could be setting in silently, and the earlier it's identified, the greater the chances of reversing it with lifestyle changes. Small adjustments to a balanced diet, regular physical activity, and stress management can make all the difference between preventing type 2 diabetes or having to deal with it for the rest of your life. The question that remains is it worth waiting for symptoms to worsen before taking action? Those who understand the importance of prevention get ahead and gain long-term quality of life. If your body is giving you signs, it's better to listen before it's too late. But is knowing this information enough? What can really be done starting now? The information is in your hands. You've learned the signs of prediabetes, understood what's happening in your body, and know there's still time to act. But what's the point of knowing all this if nothing is done? Prediabetes won't wait. Every day of neglect is another step toward type 2 diabetes, and when that happens, there's no turning back. So the question is, will you ignore these signs or take control of your health? Small changes can make all the difference. Start by adjusting your diet, moving your body, and monitoring your glucose levels. Your future depends on the decisions you make today. Now, tell me, which of these symptoms have you already noticed in your body? Comment below and share this content with those who need to know. And of course, subscribe to the channel and turn on notifications, because here you'll keep learning how to protect your health before it's too late.